I wanted to bring you guys with me today. I am at my doctor's appointment for surgery for my adrenal gland. So that's one of the health issues that we can start to talk about. I do have a tumor on my adrenal gland, which is Cushing's syndrome or Cushing's disease. So right now, I'm at the doctor's office, seeing the surgeon about having the surgery to get the tumor removed off my adrenal gland, which this will be the second time that happened. We can talk more about the first time. Well, basically, I'll give you a little backstory. The first time they took the tumor off my adrenal gland, they removed my adrenal gland and the tumor. But because the tumor had been in my body so long and I didn't know, it enlarged my adrenal gland. The adrenal gland should be the size of your thumb, and it sits on top of your kidney. And it is a hormonal gland, and it controls a lot of things. It controls your metabolism, so you can't keep your weight down when you have it. It controls, in women, it controls your ability to maintain pregnancy. The first time when I had it, I had a miscarriage. I had a stillborn because I didn't know I had the tumor. It causes your blood pressure to be uncontrollable. Right now, I'm taking a lot of blood pressure pills because of that. It makes you have diabetes. When they took the tumor out the first time, I did not have to take diabetic medication. The first time for 7 years. So from 2010 to 2017, no diabetic medication.
Read his note, and I understand that you had a history of the adrenal gland on the left being partially removed in 2010.
Yes.
At Christ, is that right?
Yes. Well, I thought they removed the whole thing, and they did too. So what happened is the tumor was so big that it enlarged my adrenal gland. Mm-hmm. So they kind of had to estimate how big it was, so they accidentally left the piece in.
Okay.
And so in 2017, I went to the doctor, and he was like, "What's going on? Your blood sugar is off the chain, and your blood pressure is high. What happened?" I'm like, "I don't know. Last time this happened, I had this problem, and we checked it, and it was still on the same side." So since 2017,
okay,
been trying to.
And did your blood pressure become a problem again?
Yes, blood pressure and diabetes. So when I got the tumor taken out the first time, I had no diabetic problems at all. Didn't have to take any diabetic medication for 7 years. Mm-hmm. So when he said that, I was like, diabetes, I have, the only time I've ever had diabetic problems is when the tumor is in my body.
And your blood pressure improved after the two?
Yes, I went from taking 5 pills to 2. I'm currently on 5 pills again right now. So.
And then you ended up in Dr. Jane's office because your primary doctor found that the levels were high again, or what happened?
I started to see endocrinologist here. In 2015, I moved to Minnesota. And then, so that all happened in Minnesota in 2017. I moved back in 2021. And so that's when I just came here to finish the treatment. My doctor in Minnesota had left. So I was just like, I'll get a new doctor when I move back to Chicago.
And do you remember when they removed your adrenal gland? I assume that they said that everything was benign and normal.
Yep, everything was benign, everything was normal.
Have you had any other surgeries in your abdomen?
Yes. Almost all of my surgeries have been in my abdomen.
Okay. Let me see if I've got them all. Partial hysterectomy
Yes.
and C-section.
2.
Anything else that I'm missing?
I had ovary surgery. I had a tumor
Ovary?
that popped, yes, on the ovary.
Is that done laparoscopic?
Yes.
Okay. Any history of hernias in the abdomen?
I have one now. I'm going to see the gastric doctor for that on Thursday.
Okay.
That was when doing my pregnancy with my daughter. And the last month or so I've been having gastric issues. And I was in the emergency room maybe like 2 weeks ago. And she said she thinks it's the hernia that's causing the problem. So
you're getting abdominal pain? Okay, so you see one of the gastric doctors at Rush?
no, only thing I come here for is endocrinology.
Okay.
And all the other things I'm at the University of Illinois. Well, as you can see, you guys, I made it home. So, I will give you the rest of the updates. So, it became a lengthy conversation with the doctor. But, we did talk about scheduling the surgery. And, it will be in November, maybe December, because his partner is on maternity leave right now. So, I will keep you guys updated with that as far as the surgery for the adrenal gland. The other thing is I want to ask you guys to please follow me to get updates. I need to get more followers on my page in order for me to be able to go live so we can have live discussions so you guys can ask the questions that you would like to ask. And so we could talk about other health issues. So I need you to follow to get the algorithm going. And so we can have our live discussions. So I see you guys later. Peace.